So today we have a young Asian male who's got very, good lips, but he wants reduction of the upper lip. This is very different and unusual than the normal lip reductions that, I do. Usually it's for silicone lips that are really big, or they're just big lips in my African American patients. This is different because in this case, the patient wants only the area of the upper lip sucking pad reduced. Now that can be considered beauty in a lot of, women, but in some males, if it is prominent, then it can look a little strange, so we want to reduce it. So I'm going to have the patient make a little face with, I'm going to actually show you right there. I want you to put right there. This is the area. Good. Put your lips together, please. Thank you, right there. So now you can see the sucking pad sticking out. So in this case, what I have to do is starting from right here to this point right here. I'm going to reduce that area. So if you notice this line of the upper lip here, it continues straight and not dip down to create the sucking pad. That's what we are going to do. And that'll be interesting. So think of it as not reduction of an upper lip, but reduction of the sucking pad. Sometimes what I do is after numbing, before I even prep with betadine, I go ahead and mark almost like a mild incision because I'm afraid of losing my marker. Sometimes it can become a little, faded. I don't want to lose that. Sometimes if I'm sure it's going to stay, I don't. But in this case, I've numbed up. Patient is all nice and numb, so I want to just mark it before I do the betadine prep and the draping and everything, because then when I come to excise or incise and there's no marker left behind, then I'm in trouble. This way there's no chance I'm going to lose it. It just oozes a little more. I haven't had a lot of chance for the epi to kick in, but still it's not a lot of oozing. It's manageable. So we'll do just very little, almost like drawing with the 15. So I hope you can see it. There we go. It's very gentle. Very superficial. You don't have to do the whole thing. There you go. The top. I'm sorry, the bottom. Bottom is more likely because of the wet mucosa. Top is less likely, but still good to have it. Just very feather touch. Don't have to go deep at all. Feather. Just a little feather touch and keep going. So there you go. This is my best marker. It'll never fade. There you go. We have finished the surgery. It went excellent, and you saw the markings, and we just followed those, and it's very swollen from the local anesthesia, but you can see that you can barely see the stitches. I used 5-0 Vicryl for the deeper areas and 7-0 Vicryl for the mucosa itself. It's going to blend in very nicely over time. Very happy. Let's show you the amount that I removed. We saved it right here on the side, and there it is. And I'm going to give you some perspective as to how much it is. So if you look at this, there we go. So almost like 1, 2, almost 3 centimeters long, and I would say about at the most 8 millimeters wide. Yes. If I push hard on it, almost like 1 centimeter. So 3 centimeters by 1 centimeter. That's what we got. Very good.